Uh, Hi, good afternoon, everyone. I'd like to thank Global Wellness and Integrated Health Congress Organizing Committee for inviting me. It's a great honor to be speak to you. Today, I'd like to talk about the effects of facial EMS device on the mental health in women, a pilot study. Background, cases of major depressive disorder, MDD, and anxiety disorders increased by more than a quarter worldwide in 2020 due to the COVID-19 pandemic. According to the first global quarter worldwide estimate of impact of the pandemic on mental health published in the Lancet. In 2020, cases of MDD and anxiety disorders increased by 28% and 26% respectively. Women were affected more than men, and younger people were more affected than older age groups. Contributes with high COVID-19 infection rates and major reduction in the movement of people. A consequence of measures such as lockdowns and school closures has the greatest increases in prevalence of MDD and anxiety disorders. Even before the COVID-19 pandemic, MDD and anxiety disorders, which can increase the risk of other health outcomes such as suicide, were major contributors to the global burden of disease affecting millions of men and women of all ages around the world. Also, the global COVID-19 pandemic has changed our lifestyles greatly, and one of the biggest changes that we were required to wear masks. The use of face masks was protective for both healthcare workers and people in the community exposed to infection, with both the frequent and batch analysis lending support to face masks use irrespective of setting. On the other hand, wearing masks obscure the lower half of our facial expressions and have changed the way we communicate. Originally, we refer to various cues such as eyes and mouth in facial expressions and integrate them to read emotions. However, wearing face masks can affect the communication behavior of speakers and listeners. In fact, it has been empirically reported that masking the lower half of facial expressions hinders the recognition of emotions from facial expressions and reduce their accuracy. Then, face masks may reduce speech intelligibility and reduce facial cues associated with language comprehension. Furthermore, several studies have reported discomfort caused by wearing masks. Recent studies have been reported on the factors that affect the accuracy of emotional recognition from facial expressions while wearing a mask. It's as below. Empathy, autistic tendencies, recognition of subtle facial emotion skills. It's known that one potentially promising method for preventing psychosocial stress is physical activity and exercise. Overall, findings from meta-analysis, reviews, and recent randomized controlled trials encouraging results for the use of PA in the treatment and prevention of depression in the general population. Also, PA has been shown to improve the mood of a person with mild to moderate depression, just as well as antidepressant medication, CBT, or social support. our research question is facial muscle activity effective for the mental health of women? Sorry. But there are some problems of PA and exercise interventions. In the face of stress, there are others become inactive. Habitually active individuals exercise more in the face of stress, and those in beginning stage exercise less. In Japan, Kumagai, etc. reported that since 50% of exercise program participants drop out, strengthening adherence to exercise is a major issue. Also, we have been found to suffer more from chronic stress than men. And some research suggests that women, compared to men, more often find themselves in stressful circumstances. Therefore, we focused on exercising not skeletal muscles, but facial muscles, which is essential for cosmetic behavior. About importance of facial muscle activity. Facial movements are unique and present considerable differences compared with the rest of the human model repertoire, in particular with movements of the upper limb. Then, the neurons contributing the control of facial muscle movements are distributed over several brainstem regions. Voluntary controlled facial movement patterns may affect the autonomic nervous system and heart rate variability, HRV, such as breathing. In addition, facial muscle activates the motor component of the ventral vagal complex, which originates in the nucleus ambiguous and regulates and coordinates the muscles of the face and the head with the bronch and heart. Emiro, etc. indicated that mental health mediated the association between each psychosocial resource and younger appearance. In other words, in order to maintain and improve health, the face also needs a certain amount of muscle mass. Our previous research reported that voluntary facial muscle exercise effect for mental health. In other words, in order to maintain and improve health, the face also needs certain amount of muscle mass. Therefore, in this pilot study, we aimed to clarify affect facial EMS device for the mental health of women. Next method. Now I will explain the methodology. First, we recruited 20 subjects, women. Subjects used facial EMS device for 10 minutes every day, 8 weeks. We measured mental health as a subjective evaluation and surface electromyography as an objective evaluation. All results were run on SPSS version 25 software, and p-values below 0.05 were considered statistically significant. The study was conducted according to the principles of Declaration of Helsinki and to get the informed consent that is enough for subjects. We use the GHQ-12 version Japanese to evaluate mental health status. The GHQ-12 is a widely used self-administered questionnaire that was originally designed as a screening tool for mental health. The GHQ is also used in primary health care screening in the general population survey. The GHQ-12 score was first applied to adults and then validated for adolescent as well. Every item on the GHQ-12 describes a symptom and has 4 possible responses. The 2 answers which indicate the absence of the symptom are given a score of 0, and the other 2 which indicate the presence of the symptom receive a score of 1. The overall score on the scale will fall into range of 0 from 0 to 12, with higher score indicating more psychological distress. Good mental health was defined as a GHQ-12 score under 4, and poor mental health as a score greater than or equal to 4. Next, about facial EMG. Electromyography WEB1000 for facial muscle surface electromyography measurement was evaluated using. There were 2 protocols. Action A is imagining your favorite food and expressing a smile. Action B is raise the corners of your mouth and apply force, then remain still for 5 seconds. Result. The GHQ-12 score improved by 3.1% after 4 weeks, and by 4.3% after 8 weeks compared to before the intervention, both of which showed significant difference. Facial EMG action A, 30.5% after 4 weeks and 38.8% after 8 weeks compared to before intervention, both showing a significant difference. About discussion. Our previous systematic review reported that voluntary facial muscle exercise may help improve depressive symptoms, mood, and reduce level of chronic stress. Comparative suggested that functional electronic stimulation therapy to facial muscles involved in voluntary smile expression improved symptoms of MDD. Then, a pilot study in which after 2-3 months, postnatal women performed facial muscle training for 30 minutes once a week for 1 month. The Edinburgh Postnatal Depression Scale, EPDS, and happy expression rate statistically significant difference. So we speculate that stimulation of the zygomatic major muscle by passive rather than voluntary facial EMS device produced similar psychological effects to those described above. About effect of facial exercise on facial expression. In this study, pre and post the intervention, we asked the subject to do actions and took pictures. As a result, there was a statistically significant difference in the integrated values of the subject's zygomatic major muscle after 4 weeks and 8 weeks in both experiments. In previous study, although happy expressions are the most easily recognized of the affective facial expressions, they are typically misconstrued by patients suffering from depression. Then the improvement in happy expressions in women after facial EMS device likely that may have affected neural responses by continuing voluntary facial movements. Conclusion. First, facial EMS device may have been effective for women's subjective mental health. Two, it was suggested that the facial EMS device was effective in improving the activity of the zygomatic major muscle in women. Finally, near the future, there is a need for intervention studies with a high level of evidence, such as RCT crossover designs. Finally, our research group, MDZ, and the University of Tsukuba. Thank you for your attention. I'm looking forward to your opinion and guidance. Please.
Thank you, Doctor. Any questions from the floor? Oh yes, we've got one. There's a quick hand up. Good, hang on.